Hicks had traveled with the president and his entourage, and then again to a campaign event on Wednesday. It was Wednesday on the way back from that event in Minnesota that Hope Hicks was quarantined and subsequently tested positive. It was later then that the president, as the night went on, was tested, and we learned late last night, early this morning, that he as well had tested positive. The questions in between, though, was that what had the president done in between? How many people had he been in contact with? And who else would be contact traced as a result? You're seeing Marine One here, a picture of Marine One, and we want to let you know, too, that as I understand, Marine One is just about to land or has just landed at the White House. We're unable to get you a picture of that, but Marine One has landed at the White House and will pick up the president and take him to Walter Reed Medical Center. We understand the president has been given an experimental antibody cocktail. We heard earlier from the president's chief of staff, Mark Meadows, that he was suffering mild symptoms. That was today. We don't know any more about that other than the fact that he was to travel to Walter Reed now and remain for a few days on the advice of his doctors. So that's what we know to this point about the president's condition. We don't know whether he was just recovering or planning to at the White House, but whatever happened today, there was a change, and they have now decided to take the president to Walter Reed. Let's check in with Joe Khalil, our Washington, D.C. correspondent. Joe, what can you tell us?
Well, we know that earlier this morning, both Kayleigh McEnany, the press secretary, and the chief of staff, Mark Meadows, laid it out and said that the president had mild symptoms and that he was in good spirits. His doctor put out a note saying that he was fatigued. But yes, you're absolutely right, Joe. This is a change, and, you know, some people may find it unsettling. But here's what Kayleigh McEnany said about this change. She says the president remains in good spirits. Mild symptoms have been working throughout the day. They say that they're taking the president to Walter Reed now out of an abundance of caution, and that the president is going to still be working in his presidential duties, but he's going to be doing that from the offices at Walter Reed Medical Center. So that is from Kayleigh McEnany. That's the latest. And she also went on to say the president and the first lady appreciate the outpouring of support. Now, it wasn't as though this was something that was planned earlier in the day. There was no mention of this early in the morning. All things pointed to the fact that the president was going to be in the residence and that the doctors were going to be treating him from the residence. That was the plan earlier this morning. So we're not hearing anything about the president's condition changing as of yet. But that's the latest from Kayleigh McEnany, the press secretary. Really tough spot here for all of us reporters trying to cover this, because we're not hearing much about his condition changing, and obviously we don't want to speculate at this point. So just the facts are that something changed between this morning and now, where they are in fact taking the president to Walter Reed Medical Center. Now, we should know that there was another trip to Walter Reed a while ago that the president took that was unannounced, and there wasn't much in terms of details coming out of that visit. That obviously months before, you know, this coronavirus diagnosis. So this may be, according to what Kayleigh McEnany put out, just an abundance of caution thing, and they want a number of doctors there around the president, according to her, as he continues to work in his presidential capacity. Because obviously we're going to continue to be digging on this, but that's the latest here from Washington. The president being taken now, sort of on not given much notice to the press. He is. If you had images there of Marine One taking off and taking him, he should be there either now or momentarily.
Joe, one thing that stood out to me was that he was described as fatigued. You and I were together about 7 or 8 days ago and saw in real time just what kind of schedule he keeps up with the campaign rallies that he's back onto. When you and I were together last, he had been to Ohio the night before. He was back to the White House for our interview and then off to Pittsburgh that night. He runs at both ends.
He is tireless. I mean, even the president's harshest critics will concede that. And, you know, even as of yesterday, or this morning, rather, we had Congressman Steve Scalise one of many members of Congress expressing their prayers and their hopeful well wishes for the president, saying, look, if we know anything about this president, it is that he is tireless. He maintains a schedule that is, quite frankly, impressive when it comes to how much he is able to do in a day. And you're right. And just yesterday, I mean, the moment in question, he went from Washington to this event in New Jersey, doing another big fundraising campaigning event where there were hundreds of people that were interacting with the president. So, yeah, certainly he seems to be somebody who is tireless. For him to be described as fatigued today by his doctor, that is something that is certainly remarkable, because that's not a word, as you mentioned, Joe, that you hear very often when it comes to the president. There is reporting as well that there were a couple of people at the president's event yesterday that described him as looking sort of tired. And again, remarkable and noticeable when somebody says that about President Trump, because he maintains this schedule where he is oftentimes at 3 or 4 destinations all around the country and then ends up flying back to Washington at night or early in the morning. Yeah, we're going to have to really monitor what's going on there at Walter Reed, because if the doctors felt that it was important enough to bring him from the White House there, even out of an abundance of caution, that sort of leads you to believe that there may have been something that they noticed that was different about President Trump from earlier this morning, when the plan was to just have him in the residence and deal with him and treat him and do whatever he needed to do from there in the White House.
All right, Joe, we're going to ask you to stand by and continue to tap into your knowledge and resources. And in the meantime, we're going to do the same thing with our Dean Reynolds. Dean, your history of covering presidents runs volumes deep. I'm wondering what your response is to what we're watching right now.
Well, Joe, the dearth of information is one telling point. I mean, if they have good news about the president, they're going to rush it out to reporters. The fact that he is being moved to Walter Reed Army Medical Center is not a good sign. You know, if he could be treated for, what is it called, fatigue or mild symptoms, that sounds like he could be treated in the White House, where they have, you know, extraordinary medical equipment and so forth for a president who falls ill. Going to the hospital takes that up another notch. Now, as far as the campaign goes, it's almost now anticlimactic. The president's campaign said that all previously announced campaign events involving the president's participation are in the process of being moved to virtual events or are being temporarily postponed. Again, that goes with, you know, with what we have just learned, that he goes to the hospital. We don't know how long he's going to stay there. But again, if they had really good information, they would be flooding the airwaves with it right now. And this is somewhat alarming. I'm not a physician, but when the President of the United States goes to the hospital, that's something you would pay attention to. I remember when Ronald Reagan had a cancer diagnosis, it took hours for the White House to compose a statement that they thought would not shock the nation. They finally did, but again, it took a long time for them to come out with a statement. And, you know, I worry about what I'm hearing and not hearing from the White House on this.
Dean, I think you've made a great point here, because none of us wants to jump to conclusions here. But what we can do is consider the facts, consider what we do know, which is what we did last night. We knew Hope Hicks had tested positive. We knew, at least initially, that she had been with the president most recently the day before and the day before that at the debate. We also knew, as the night went on, we hadn't heard. We're well aware of the fact, because I'd been there just a week and a half ago, that there are these rapid tests at the White House. There was no mention of a result from that test, which again makes one wonder, without taking jumps to conclusions here, after 3 or 4 hours, and then there came word that we were potentially waiting for a result for tomorrow. You could make the determination perhaps that this was a more efficient and more effective, a more detailed test. So that gives you the clue that the initial rapid response tests were coming back as positive. Again, without taking any jumps as to why he's going there now, these are all facts, as you point out, to consider the fact that he is no longer at the White House and being taken to Walter Reed.
Right, and I would just add that, you know, he appeared to be very robust at his rally in Minnesota Wednesday night, giving his standard rally speech with a big crowd outdoors, people shoulder to shoulder, very few of them masked. So if he's in the hospital 2 days later, that would suggest a rather rapid decline. Another thing that may tend to alarm people about his condition. Now, if the White House is saying he intends to work from Walter Reed Hospital, that's a good sign. We just don't know much more about it, though, and speculating when the president's been taken to the hospital can be dangerous in and of itself.
Dean, can you remember a time where we've had an event like this, of this magnitude, this close to an election?
Wow, no. I mean, we're a month out, and I can't remember any candidate, much less a president, falling ill. Now, of course, there was Hillary Clinton's pneumonia in 2016, which I think occurred in September before the November election. But, you know, she was not the president of the United States. This adds a whole nother layer of importance to what's going on here. But no, I think this is unprecedented in what has been an unprecedented year on so many levels. We're going to have to find another word for unprecedented.
All right, Dean, thank you very much. We're going to ask you to stand by as well, and I'm going to bring in my colleagues right now, Rob Nelson and Marnie Nelson, who will be joining us here on the set in just a minute. And Rob, let's start with the statement that has been released just a short time ago from the White House.
Right, we have this from Press Secretary Kayleigh McEnany. She says, quote, President Trump remains in good spirits, has mild symptoms and has been working throughout the day out of an abundance of caution and at the recommendation of his physician and medical experts. The president will be working from the presidential offices at Walter Reed for the next few days. President Trump appreciates the outpouring of support for both he and the First Lady. So that is confirmation directly from the press secretary that President Trump is being taken to Walter Reed. Again, she's saying it will be for a few days. It's out in an abundance of caution. He will continue to work through the offices there at that medical facility. Regardless, though, this is a serious and concerning development. There are legitimate questions about the president's health at this hour. Obviously, the news broke late last night, and when he tweeted out that he and the First Lady had tested positive. Now, just a few hours later, not even 24 hours later, here we are with him going to Walter Reed. It does speak to a serious and perhaps escalating situation, that they felt that whatever the medical apparatus may be in the White House, that was no longer enough, and perhaps a hospital stay of a few days would be more appropriate. None of us up here is a doctor, but any layman watching this, I think, would have that same reaction, that things have grown a little more serious, and it's something we will have to watch very closely over the coming hours and days.
Okay, we have Michael Bush, former White House aide, on the phone with us. Michael, thank you for talking to us. First, tell us what you know at this hour.
Well, it certainly seems to be a prudent course of action. You know, when I worked for former President Bush, 41, and he had his atrial fibrillation event, you know, they took him to Bethesda Naval Hospital. You know, we're obviously pleased to hear that the president still has mild symptoms, and this is a precautionary measure. But given the resources available at Walter Reed, it seems to be a prudent course of action at this time, so he can have the full medical staff monitoring his situation.
Michael, I think a lot of people at home may be asking, there are doctors at the White House, he's getting the best medical care, to send him to Reed. Is there anything that we should read into that at this point, or does that seem like standard protocol?
I wouldn't think so at this time. You know, I would think it would be standard protocol. I mean, even though they have the best medical team surrounding him 24/7, it still is at the White House, and so there are limited resources, certainly not the full resources available at Walter Reed and all the specialists that are there. And the president can conduct his business from there. You know, it's built for regular checkups and also emergency situations, so it seems to be the smart move.
Michael, you've flown on Marine One and Air Force One. Take us inside. Give us an idea when you talk about how many people typically would fly on either aircraft and what the logistics are like inside.
Yeah, from a social distancing standpoint, certainly Marine One would be the bigger, I guess, point of consternation. You know, it's not a very big aircraft. You know, looking at the video with the staff coming on with the president, that is what I would consider a full helicopter when you layer in, you know, the two pilots, the crew chief, the two Secret Service, the doctor, and the military aide who has the nuclear codes, the football as we call it, along with 5 staff and the president. It is impossible to social distance inside there, and as you saw the footage, certainly Hope Hicks was part of that manifest. On Air Force One, it's a little bit easier for the president because his suite, if you will, is in the nose of the aircraft. But as you go back further along the plane, you know, the senior staff will be in one room, and then the rest of the staff in another, and then the secret staff in another, and then the press working your way backwards towards the plane. But, you know, all of your efforts are to keep the president, you know, in this bubble and kind of protected from a distance. Well, once the president's infected, then all bets are off. So who knows how far down the chain within the staff that has infected. And so, you know, I'm sure that they are doing a ton of testing with the military, with the Secret Service, with the press corps, and all levels of the staff. And I'm sure it's a very unsettling situation for them. And then now just to see the visual of the president airlifted to Walter Reed as a precaution, but that just heightens up the, you know, the intensity.
And can you talk about what will be happening at the White House behind the scenes? Even if it is precautionary, there are a lot of things that have to be worked through, prepared for. What are some of the things that will be happening behind the White House doors right now?
Yeah, well, certainly there's an effort on the communications team, you know, to release, you know, accurate and timely information. You know, this is obviously, you know, the president's health is always an important event, and so it's really important that they divulge accurate information on a timely basis to keep, quite frankly, the world, not just America, apprised of the situation. In addition, you know, there's the continuity of government, and so there are people whose job it is to make sure the continuity of government, where they know their resources are, and that the president can effectively continue to do his job. And if he shouldn't be able to continue to do that job for whatever reason, there are contingencies for that. But, you know, it goes down the chain of security, communications. The wrinkle that you have this time is that the people in those positions may be exhibiting symptoms or not themselves. And so I'm sure that there is a heightened sensitivity and intensity to, you know, what would normally be already an intense situation. But now those individuals might be dealing with their own nervousness about their health.
And Michael, you make such a great point, because we can't forget the number of events that the president has been to over the last several days before it was public that he had the virus, and in terms of the travel that he has done. Just in the past week, we had the Supreme Court announcement last weekend, last Saturday. He had the debate Tuesday night in Cleveland. We had the rally in Minnesota. Wednesday night, pardon me. We had the fundraiser in New Jersey. He flew to that. So he has been in multiple cities, multiple states. He's been on his airplane more than once. And the number of people who have come into contact with him, or come into contact with those who've had contact with him, you know, what we're seeing kind of play out here, especially as we find out that 3 journalists have contracted the virus who have been around him, and another staffer there in the office. It does speak to how easily spread this is. And when someone is as busy and as well-traveled as our president usually is, including President Trump, there is a ripple effect to this in terms of his entire inner circle, and by inner circle, the very top levels of the American government. If you think about this situation in that context, it is a little frightening in terms of where we go and who else may have this.
No question. The contact tracing is going to be difficult because of exactly what you said. It's a very active operation. They've been traveling. This is the thick of the campaign. You're 30 days out. You're exhausted. You're trying to get a lot of work done. Everybody, all the staff is already, you know, operating on fumes. And then now the president has also tested positive, and so to work backwards with everybody who they've come into communication with and the advance teams that are there ahead of time and all the people that he's met in the Rose Garden, in the Oval Office, who's been on the plane, who's been on the helicopter, who's been at these events, the fundraisers. It's going to be a very difficult task for them to really keep tabs on everybody.
Michael, you've had a front row seat to this, not necessarily what we're watching right now, but in the past, similar situations. I'm wondering, what will you be looking for as far as information, facts, things that are released over the next 2 to 3 hours that will be clues to you as to what's happening right now?
Yeah, you know, having, again, been through this before with former President Bush, you know, my old boss, Marlin Fitzwater, which I, you know, happen to think is one of the gold standards as a press secretary, you know, at times like this, the world needs to see you as a nonpartisan voice. Really difficult to do during the last month of a campaign. And Kayleigh McEnany is relatively new to her job. But I'm sure she'll, you know, do her best to step up to the plate. It's important that you give overt, accurate, timely information in a time of crisis. And I think that, you know, the more that they can divulge in the right manner, and I would also have medical professionals involved in that communication message, that they can also be trusted voices. They know more about the science and what's happening with the president. That's very important. It's important for the other leaders in government to be available and show their face, including Vice President Pence, just to give that, you know, assuredness to the world and especially to the American public that the government continues to operate. You know, stay on message, but make sure that your message is clear, concise, and accurate.
And Michael, speaking of that, as we watch this situation unfold today and over the weekend, who should we depend on in terms of that public information, in terms of accurate, timely, apolitical information? Who kind of takes over the communication apparatus? Is it still the press secretary of the White House? Is it personnel at Walter Reed? Who becomes the person we're going to see at the microphone over the next few days as the world keeps an eye on President Trump's health?
Now, certainly, you know, at the Chief of Staff's direction, well, at the President's direction, but the Chief of Staff coordinating it, it's the Press Secretary's job to be that conduit of that information to the press corps and to the public. But they may choose to have the President's physician or other physicians that might be involved as part of the Walter Reed team to be that voice. It would not be, in fact, it is quite normal and common to have press briefings with those medical professionals, perhaps from the hospital or some other venue. And so you're really turning over the messaging when it relates to the president's health to those medical professionals. Since it's related to COVID, I don't know if they would bring in someone from the task force, certainly a trusted voice and respected voice like a Dr. Fauci as part of it. But as it relates to the president's health, I would imagine it would be his physician and spokesperson coordinating that effort, again, at the direction of the Chief of Staff. And then I would assume that that Vice President Pence would be part of that messaging as well.
How soon do you expect that kind of messaging to come out? Because obviously they're walking a very fine line here with caring for the president, but also making sure they're being transparent and clear and emergent with the information with the American public as we're all trying to gain information. How soon should we expect to hear from some of these doctors or medical staff?
I would imagine that you know, given what has just recently transpired, that they would try to have some sort of briefing. They should be answering, you know, some sort of venue where they can answer questions before the evening's done. That would be certainly, I think, the expectation that, given what's going on in the appetite for people to know, a simple statement would not suffice. They need to get somebody up on air that can answer these questions. I don't know that it's in a press availability, a press conference format, but certainly somebody who can answer these questions and have a little bit of a back and forth and update the world on the president's situation.
And Mike, I've heard other analysts kind of describe this current situation as the most dire and serious medical crisis for a president since the attempted Reagan assassination back in the 80s. And if you put it in historical context, that's a sobering thought. We don't know how this will turn out. We should mention that the fatality rate of this virus right now in the country is 3%. The odds are that the president will be okay and will come through this. He does have some risk factors. We all know that. But by and large, most people who have this do recover. They don't succumb to this. So there's a bigger picture. It obviously is a big story because we're talking about the commander-in-chief, the president, the leader of the free world. But in case this does take a turn, and that's a huge if that no one knows, talk a little bit about perhaps what is going on behind the scenes in the event the president is no longer able to carry out his duties.
Yeah, as you said, it is the unknown, and the symptoms, as we know it reported, are mild. This will be a progression that hopefully doesn't get any worse, but as he goes through that convalescence, I think is their term, and continue to monitor his situation, they will then look at their contingency plans and act accordingly. There are contingencies upon contingencies. It is the full-time job of certain individuals to plan for this, and so I have no doubt that they're being responsible, getting whatever assets and individuals in place to make sure that everybody can perform their role should they need to. Again, we hope that they don't. But, the whole continuity of government, I'm sure that these contingency plans are being put into place. And obviously assuming that there are individuals whose job it is to perform those operations are also in good health and able to perform them, because that goes down from the president down to many, many layers of who needs to play a part in that. And I am sure that everybody is working very hard to make sure that they have continuity of government.
Michael, just the words, the president is being flown to Walter Reed, might bring a little more urgency to it as well. But I'm wondering, why not logistically just drive there?
Every time that I've been a part of that, the president has always flown. It's not that uncommon, and it's far easier if he is not in good health, or even when they would go for a checkup. It wasn't uncommon. In fact, it was very common for the president to take Marine One from the South Lawn and land up there. And so I would not draw a correlation between the urgency of his situation from a health to the fact that he got on a helicopter. That would be quite normal. In fact, I would think it would be abnormal if he took a motorcade. That just isn't done very often to Walter Reed. But certainly any time that you're hearing that the president is having a health issue and has been flown to Walter Reed, even if you're hearing it's precautionary, your mind starts to go into several different places. Right. And again, having been through that before, it's a scary situation. It's a serious situation. But these are professionals. It's a prudent course of action, and we'll just have to wait how things unfold. I just think that they need to be very careful about giving timely communication to keep everybody abreast of the situation.
If you are just joining us here on News Nation, we are in breaking news coverage. President Trump has been flown to Walter Reed Medical Center. Joining us on the phone is Michael Bush, the former White House aide to George H.W. Bush. Michael, if people are just tuning in and learning this news, if you are in the White House right now in your former role as an aide, what are you doing? What is your job to assure continuity in government and to help communicate to the American public? What is task number one in the White House?
Yeah, so my specific position was assistant press secretary and traveling with the president every time he left the gates of the White House. So specifically, I probably would have been up at Walter Reed along with potentially the press secretary to communicate that message and get the information from the doctors. You have the responsibility to digest that information and determine, again, along with the chief of staff and others in senior staff positions at the White House, when and how you're going to communicate that message. So from a press office standpoint, I'm sure their phones are ringing off the hook back at the press office at the White House. I am not aware if the press secretary is with the president or not. I'm sure there is a spokesperson with the president at Walter Reed, so they can again have that connectivity from a messaging standpoint to get the facts on the ground at the hospital and report that back to the White House. And so there's a little bit of a coordination of staff, particularly in the press office, that needs to help on the messaging front. And then behind the scenes, whether it's security, military communications, the chief of staff's office, everybody is doing their job to make sure that they can, rise to the situation that's unfolding right now and think of every contingency that they need to do. They're going to be in frequent contact with the vice president's office as well, given his role, obviously, constitutionally, but also his role as a senior advisor to the team.
And Michael, just one more question for you. Who would be with the president right now, aside from his doctors? We know that the First Lady has also tested positive. She has mild symptoms. Who would be at his side right now as he's being transported to Walter Reed?
There's a core group of people that are always with the president, typically. It is the military aide. It is the president's physician. It is at least a couple agents. And typically some senior advisor or chief of staff and a spokesperson. I didn't have a chance to see the footage of who was with him, but that is typically what we call the secure package of individuals that are with the president, so that they can help him make the decisions and exercise his responsibilities. Now, depending upon the situation, there might have been more medical staff that got in, but again, you start to get into a size capacity issue on Marine One. You can't take everybody necessarily that you want to. So I would imagine if they feel like they need other staff up at Walter Reed, they would be traveling by vehicle up there. At the same time, you're not trying to inundate, even though the president has a hospital suite up there, you're not trying to inundate the hospital with extra staff people. So you typically have a core team around him, and then those advisors are working with the rest of the staff back at the White House.
All right, Michael Bush, you've been a wealth of information. If we could ask you to perhaps be on standby for us as we progress here through the evening, we've certainly enjoyed your knowledge and appreciate your time as well. We'll talk with you soon.
Thank you.
And one more quick point here. Spokesman says Vice President Mike Pence is at his official residence at the U.S. Naval Observatory in D.C., as, of course, the White House is preparing to take the president to Walter Reed. Says the vice president is in good health, and they've also made it clear that President Trump has not transferred presidential power to Mike Pence. Donald Trump is still the president. There's been no transfer of power, which sometimes can happen if the president is incapacitated in any way. We are not at that stage and may never be. But as of this moment, we are not there, just to be clear. And
another quick point of clarification. The White House, the Marine One has not yet left the White House. So the president has not been transported just yet to Walter Reed. You're looking at a live picture now of Marine One waiting for that transport.
We want to introduce Dr. James Baker. He's a professor of allergy and immunology at the University of Michigan Medical School, former member of the Council of Advisors for the Office of Science and Technology Policy in the Bush and the Obama White House. Doctor, thank you so much for joining us. I want to start with this news today that the president is going to be transported to Walter Reed. We're watching Marine One now. First, from a medical standpoint, your response to what's going on.
So I think actually the fact they're transporting him is in some ways good news. The president, I actually was a military physician at Walter Reed for over 10 years. And I agree with Michael Bush. Any type of visit to Walter Reed from the White House usually occurred by helicopter. That was the standard. If the president were acutely ill, if he was having respiratory distress or some type of acute problem, he'd be going to the closest hospital, much like Reagan did at George Washington Hospital when he was shot. So I think this suggests that there truly is a precautionary step that's being done so that he can be closer monitored and his breathing and other functions can be taken into account more closely.
Doctor, I'm reading an alert that came out from the White House, and it says that the president completed an infusion without incident. It goes on to say he had a polyclonal antibody cocktail, and he also had been taking vitamin D, zinc, melatonin, and a daily aspirin. So when you hear this treatment, explain to us what all of that means.
Yes. The experimental treatment that he got were antibodies against the virus. And this is different than the plasma infusions that people have been getting. These are monoclonal antibodies, specific antibodies to neutralize the virus early on. There's been some data that's been submitted to the FDA that suggests that these antibodies can neutralize the virus and can improve the outcome of people. I'm sure he'll also be given remdesivir, which is the antiviral drug that's been shown to be effective, as well as steroids. And those are the three things we know that potentially could help him. The good news is that his symptoms are not disconcerting. Having a fever, not feeling well, sort of myalgias, is not unusual for someone his age. I think the real issue is we have to monitor closely for respiratory issues, because when people get really ill from COVID-19, it's because they don't breathe well, they can't get oxygen into their blood. So in fact, I think that's why he's being taken to Walter Reed, to make sure that they have whatever they need to maintain his respirations if they become faltering.
And Doctor, obviously there's been a lot of discussion already today, even before we heard about this fairly dramatic news of the president being flown to Walter Reed, that he is in some high-risk groups that can make COVID very difficult, or much more difficult if you get it. Number one, he's 74 years old, so he is older. Number two, the virus typically is harder on men than women. He checks that box as well. He is obese by clinical definition, not known for exactly the healthiest of lifestyles. What role do those factors play in both his risk and in potential treatment that now he may be facing today and throughout the weekend?
So I don't have a personal knowledge of his health situation, but yes, those are three risk factors. Even with those risk factors, if you look at the potential for survival in a 70-year-old, it's greater than 90%. So the fact that he has these risk factors doesn't mean that this is going to be a negative outcome. But it does mean that we have to monitor him carefully, to give him every drug and potential to help with this treatment, and to make sure that he gets as much support as he needs as this disease progresses.
So what has to happen over the next, let's say, week to 10 days? Give us an idea, Doctor, assuming all things go well here. We've seen this virus get very serious in some patients. Others recover a little more quickly. What's ahead for the president? Let's just say things go well for him here.
So the best case scenario would be that he has about 4 or 5 days of flu-like symptoms. He feels ill. He has a fever. He feels like taking it easy. But in fact, that resolves and slowly he gets better. And he doesn't have any respiratory problems. His breathing's okay. He gets enough oxygen into his blood. He doesn't have any secondary complications. That would be the best case outcome. And within a week to 10 days, maybe 2 weeks, he could be essentially close to normal.
And obviously the timing of this is certainly remarkable, falling 31, 32 days before the election. This is really the home stretch. I don't think this was the October surprise anyone was anticipating, to borrow that political phrase. But what do you think health-wise this could mean for the president's ability, assuming that he gets through this, which seems more likely than not that he will get through this? What does it say about the potential and his ability to get back on the trail ahead of the election? That still, I assume, remains very much on the table once he gets a little further down the road.
So let's make a bit of a presumption here that the president was being monitored fairly closely for COVID. He was probably being tested every day. Once some of the close confidants came up yesterday, they did a rapid test. So in fact, whether or not that was positive, they then confirmed it with a PCR or molecular test, and that's what delayed the report by about 4 or 5 hours. It takes that long to do the more specific test. So assuming that, usually symptoms like this come up anywhere between 3 and 5 days after the infection. So if you're looking at about a 14 to 21 day course of this, you're talking about 2 to 3 weeks from last Monday, when we'd expect him to be clearing the virus and doing well under best case scenario. there are variable outcomes with people. There are some people that are ill for a longer period of time, 21, 28 days. There are other people that have more chronic problems from this. So it's really hard to predict what will happen. But if he has a totally uncomplicated course of this, he could be well or feeling well in 14 to 21 days from last Monday.
Dr. Baker, you mentioned respiratory issues would be the important factor as far as a symptom that they would be closely monitoring. How do they monitor that symptom, and what things would they be looking for that would raise concern?
Well, there are monitors that monitor the rate of his respirations, the depth of his respirations. They can monitor real time the amount of blood, the amount of oxygen he has in his blood. So that tells you how well his lungs are working. And that's the real key. If he's moving air well, if he's oxygenating his blood, then he should do fine. The problem comes if they develop pneumonia and they have a hard time breathing, if fluid builds up in his lungs and it prevents the oxygen from getting into his blood. That's a difficult thing, and they need to do maneuvers to try and help that.
So, Doctor, this has taught us at least a couple of things. I'm wondering what stands out in your mind. Asymptomatic transmission would be one that would come to mind. Social distancing, certainly on these aircraft, would be another. What comes to mind for you?
I think asymptomatic transmission is a very important issue here. If you look at young people, especially people under the age of 40, the majority of them don't have any symptoms, and they can still transmit the disease. So you can't just protect yourself from people who think they're sick. So I think, quite honestly, the person who potentially infected the president probably didn't even know they were infected themselves.
But at this point, it's still, as far as I know, unclear who infected whom. We don't know just yet. Did Hope Hicks give it to the president? Did the president give it to Hope Hicks? You know, where, again, he has traveled so much, as presidents do, and been busy, been flying and debates and rallies and meetings and around the White House. So, you know, barring real strides in contact tracing, we really don't know just yet how to connect those dots of who patient zero is really in this scenario, correct, Doctor?
And we may never know. And one of the problems with this disease is that when people are asymptomatic and in fact get well and move on without any symptoms, it's hard to know who was infected and who potentially could infect the president. It could be that a third person or you know, a chain of people at an event infected both Hope Hicks and the president. But in fact, in some ways, she was sort of the canary in the coal mine for him, because they found out she was positive, and they got very aggressive in evaluating him. And having her so close to him, it told them that they needed to be very careful and check him for infection. So that's why I'm sure they did both tests yesterday.
Which is also an interesting point, because the timeline that is beginning to get pieced together now is that I think Hope Hicks tested positive late Wednesday or early Thursday, and yet the president still got on board the plane and went to a fundraiser in New Jersey that I think was a mix of outdoor and indoor activity. So in this specific case and in general, what is your medical advice that if you were known to have been in contact with someone who has tested positive, what was the correct course of action in that moment, not just for the president, but for any of us as we try to navigate our way through this pandemic?
So I don't know the specific timeline there. Clearly, I presume that they would have done a test on the president as soon as they found out that Hope Hicks was positive. And I presume that...
Well, we may have lost the doctor's connection there, so we'll continue on his point there, because we do know that we can tell you that Democrat Joe Biden and his wife both tested negative as a result, because there was some concern about whether this might have been an issue at their debate on Tuesday night.
Right, exactly. And we also know Nancy Pelosi, as a act of precaution, got a test. She has come back negative as well. We obviously know the president, the first lady are positive. Apparently the rest of the first family, they have been tested. They are all negative. But doctors have also cautioned that one negative test doesn't necessarily clear you. It could take a few days,
Right.
and then it shows up positive. So everyone, I think, sounds like anyone who's tested negative just one time at this point is still in a waiting pattern. We'll see how the next few days play out. But so far, no other high-profile positive tests other than the First Lady and the President that we know of, at least at this point.
Right, but I think a few things that are important to note that the doctor just talked about. One, that the president has received some treatment already as a precaution, this antibody cocktail, so to speak, including a number of different medications. He said that is, in any sense, enabled to neutralize the virus, and he has said, again, his symptoms are mild. The other thing I think worth noting is what he brought up, which was people being asymptomatic. I interviewed Dr. Deborah Birx, the White House task force, earlier this week, and I said, what is the biggest misconception about coronavirus? And she said it is that anybody can have it and be walking around and show no symptoms. Her example was little Johnny down the street can have this virus, come over for a play date with your child, and you have no idea he's carrying it. That's the biggest concern with this virus, is if you think you can go out and carry on your daily activities without taking the necessary precautions, that's where we're seeing community spread. So she highlighted that as a major concern with the task force. And really as a reminder for all of us that this virus is out there, it is spreading very rapidly throughout our communities, and she said we cannot take for granted the steps that we're taking that make a difference. And you saw these big rallies that the president has been at, and both the people we've just talked to, Michael Bush, the former White House aide to George Bush, and Dr. Baker with the University of Michigan Medical Center, said contact tracing now is going to be very important to understand who has been traveling with the president, where has he been, who has been at these rallies, how close did they get, just so they can understand not how the president got it only, but also where we see community spread.
And that list just this week, based on his activities, is dozens and dozens of people, not just the people at the debate and the rally, but the staff at the White House and Secret Service, his other protective people. You know, so it really is, it's a long list. When you think about everything the president does and how much he travels, it is a long list. So that is not an enviable job.
And I will say, I was listening to a White House staffer talk earlier this morning on national news saying, you know, we understood the risk when we came into the White House. That's the risk we took. We understand the job we had to do. But it is a scary situation when you're going into an environment, as many journalists are doing as well. Or if you're showing up to work, the essential workers. I mean, it is a necessary risk to get your job done, and you have to make the decision if you want to do that. For those working in the White House, they understood the risk. And his point was, we understood our job was very important too, and we took our necessary precautions, but we still had to go to work. And you have a lot of people in the White House now who are wondering, was I close to the president? Was I close to the first lady? And trying to contact trace that.
You can imagine it's a scary day for a lot of those folks. And we already do know that one person in the White House, one staffer in the White House press office has tested positive, and 3 journalists in the White House press pool have tested positive. So to that point, that's how easily it spreads.
Well, the other good news from the doctor, I thought, was the fact that he thought it was good news that he was being taken to Walter Reed. He felt like if the president were acutely ill and this were serious or urgent, he'd be taken to a hospital. And he also pointed out the fact that this trip by Marine One, by helicopter, is not unusual at all. It might seem a little more urgent, not the motorcade you might expect. It's about a half-an-hour drive. So we wait now. You're looking at a picture of Marine One on the lawn of the White House waiting to transport the president to Walter Reed. Let's check back in with Dean Reynolds now. He has more on a statement today from former Vice President Joe Biden.
You know, Joe, this is a difficult time in the midst of a political campaign for the opponent. And Joe Biden and his wife have sent a message to the Trump family, hoping for a speedy recovery. And then they added this: this cannot be a partisan moment. It must be an American moment. We have to come together as a nation. Now, keep in mind that Biden was about 10 to 12 feet to Trump's left during the debate on Tuesday night, just Tuesday night. That's just a couple of days ago. And so they were tested when they found out that the president, his aide, had come down with this virus. they tested negative. There was some, I would say, annoyance at the time that it took to notify the Biden campaign of the illness that was spreading through the Trump entourage. But now the former vice president has resumed campaigning. He is or was in Grand Rapids, Michigan, delivering a speech earlier this afternoon. So he's hale and hearty, but they have decided that it's the wrong time for partisanship, and so that they are taking down some of those negative attack ads against the president for the time being. The president, by the way, from what I'm reading, will probably be in the hospital for several days recuperating. Now that means that clearly the events this weekend in Wisconsin are off the table. And that's probably to the good, because Wisconsin is experiencing a real surge in the virus right now, so much that a medical officer there said we're in a crisis situation. The president was planning rallies in Green Bay and La Crosse. Those are off, and I would imagine next week is probably wiped out as well. And so they're going to have to sort of plan these events according to the president's health, and that'll be planning on the run, really.
And I assume, Dean, as you kind of alluded to, the future of the debates, there were 2 more debates, presidential debates set. Those are very much in limbo. We did get word that the vice presidential debate set for next week is still going to happen, at least as of now. But it's hard to imagine at this point that the next 2 presidential debates could happen in light of what we're witnessing today.
Well, because the next one is a town hall affair full of, you know, average Americans, I think undecided voters. So, you know, I mean, if the president is just recovering from the coronavirus by then, I could see some reluctance to have a room full of people there with him while he's debating former Vice President Biden. And I think included among the people who would be reluctant would be Biden himself. I mean, he's 77 years old. The president is 74. These are the 2 oldest guys ever to compete for the highest office in the land. So everybody is sort of walking around on eggs when it comes to their health.
Yeah, and Dean, there's another comment that we're just getting from the White House, a senior White House official saying no transfer of power is expected. The president is in charge. You've covered campaigns in the past, including Ronald Reagan. President Bush 41 had his own share of health issues, but this one certainly seems to be much more concerning because of the nature of this virus.
Well, it is. I mean, it's proved fatal for more than 200,000 Americans, but the fact that there's no talk about transferring power means that they're not going to put the president under, for some reason, or for some surgery or some procedure that he might need. So it sounds like, he's just going to be treated, he'll be conscious, and in full, in his capacity as president, he won't have to relinquish any of those powers. That's a good thing, it's a good sign. If, on the other hand, that transfer of power does take place, then we're talking about something considerably more serious.
And Dean, before we let you go, I want to ask one question. People try to read the tea leaves in a moment like this. The president was supposed to be on that, I think, conference call about COVID-19, ironically, earlier today. He did not take that call. Vice President Pence stood in for the president. And for a president who has taken Twitter to a level no other president has, it is a little strange. We have not heard from him since he made the announcement late last night that he and First Lady Melania Trump had tested positive. Should we read into that? It is just so uncharacteristic for this president not to be vocal, not to address the press, not to go on Twitter. Should we not read too much into that?
I wouldn't read too much into it. I mean, if he's feeling lousy, he probably doesn't feel like, hitting Twitter. But we're way in the speculative realm here, and I don't really want to, try to get inside the president's head until we get more information. Now, one thing that backs up on this White House is credibility. There's been a lot of back and forth with reporters who believe that the president and some of his staff are not entirely forthcoming, certainly about his own health, but other matters as well. Kayleigh McEnany, for example, saying that the trip to Bedminster, New Jersey, was deemed safe because there was social distancing. Well, his top aide, the president's top aide, Hope Hicks, had already come down with the virus. That just doesn't seem to wash, and it raises more questions that need answers. So that's a problem when you have a lack of credibility in the White House press shop.
And Dean, you have to imagine that the American people and all of us as journalists are anxiously awaiting a press conference of some sort from someone from the White House. As you're looking at Marine One, we can see some foot activity just to the right of Marine One. It has not left the White House yet.
But we are
en route to.
I don't mean to interrupt you. We are getting word that President Trump is expected to walk to that helicopter shortly.
Yeah, but
we
we
don't know
won't-
exactly when, but just keep an eye on your
We
screen for
won't
that.
see him walk from that angle, if that is the camera angle. And I'm not saying the helicopter was positioned that way, but usually the cameras are positioned on the other side by the pillars, looking back toward Marine One. For whatever reason now that we're getting the other side of the helicopter.
Right. Well, the other thing, Dean, I'm not sure because when I was there a week and a half ago, as you know, the camera positions are on a section they call Pebble Beach, which is looking at the Pennsylvania Avenue side of the White House. Marine One actually landed. Here go the rotors. They're firing it up now. But Marine One landed in the back and dropped the president off after a rally in Pennsylvania. I was unable to see it from the front. I don't know if it's possible to even get that angle, but we saw the salute. So the rotors are flying up. I think we can perhaps assume that the president is now on board.
And Dean, to my point earlier, we are waiting for word from the White House so that we don't have to continue to speculate on the president's condition. I am looking at a direct quote from the press secretary saying President Trump remains in good spirits, has mild symptoms, has been working throughout the day. This is out of an abundance of caution being flown to Walter Reed. The recommendation of his physician and medical experts, he'll be working from the presidential offices. And as Joe just said, the White House is saying no transfer of power expected. The president is in charge. Given all of this, and we wait for information, how soon do you expect the White House to get out in front of this and get in front of a microphone and talk to the American public about what's going on?
Well, again, for what I was just talking about, the lack of credibility, I want to hear from doctors at Walter Reed. Those are the people I'd like to hear talk about the president's condition. Until we hear from them, the people in the press shop at the White House are not physicians and really not equipped to deal with matters of health.
Indeed, let me interrupt you briefly because now we understand that the president is on board Marine One as we speak. As you said a second ago, accurately, we did not see him walk, but now there is a photo. The president, suit and tie, and with a mask on. Again, not seen from this angle, but pictures now coming on social media here. The president, full suit and tie, mask on, did walk. Now we see the helicopter lifting off, taking President Trump to Walter Reed for what is expected to be a multi-day stay there as he gets through his diagnosis as being positive with COVID-19. So we do have that. It's important. He's taking off to the hospital now. He did walk there on his own accord. That would be a good sign. Again, he was wearing a mask, which he does not do often. He did it in this moment, even though we didn't see it on video. There are pictures now online, and now Marine One in the air, taking the president to the hospital for a few days to get treatment there as he battles COVID-19. And I think it was just the president, not First Lady Melania Trump. So she's going to stay back at the White House while he goes to the hospital for obviously what will be incredible care as the president there for a few days. Certainly a remarkable moment and chapter as this country in the world deals with this pandemic. The President of the United States being flown to the hospital less than 24 hours after letting the world know he, too, and his wife had tested positive. It is a pretty remarkable moment.
Joshua Douglas, a constitutional law expert from the University of Kentucky Law School and also a professor, joins us now on the phone. Joshua Douglas, thank you very much for your time. We were talking earlier about the continuity of government. Just walk us through behind the scenes what will be happening in a moment like this when the president is getting medical care. He's on his way to Walter Reed right now. What's happening in the White House and with the federal government just to continue a continuity of government?
Yeah, thanks for having me. So as it stands, the president is still the president as long as he can execute his powers and he's able to fulfill the duties of his office. If it became to the point where he was unable to do so, then we would be in the world of invoking the 25th Amendment to the U.S. Constitution, in which he basically would send a notice to the Speaker of the House and President pro tem of the Senate saying he's unable to discharge his duties, and Vice President Pence would take over as acting president.
One more note to that remarkable scene at the White House as Marine One took off there. We do understand, again, the president did walk out by himself, full suit, mask on, which makes sense considering that he's tested positive now, and there were some still photographers who caught that image. He did give a thumbs up. He did give a thumbs up, which kind of coincides with the message here from the White House that he has not transferred power to Vice President Mike Pence, that he's in relatively good spirits. What we have heard is that he's had a fever since the morning, that he's a little fatigued. There are reports that his voice was a little raspy. But again, overall, doing okay. And certainly walking out, giving a thumbs up, in a suit, getting on board by himself. You know, very much signaling in his own way that he is still in charge and he's going to go get treatment at this hospital. But that is an important, I think, moment and signal to the country that he is okay. We don't know what tomorrow will bring, but in this moment, he is, you know, doing what tens of thousands and hundreds of thousands of others have had to do since March, and that's going to a hospital and get treatment. He's the president. He will get the best medical care imaginable, and that's certainly a comfort and a necessity for the continuity of our government. But again, as you were saying, Professor Douglas, Mr. Douglas, that you do know that certain things have to be happening behind the scenes at the White House in case things do take a turn. You imagine Vice President Mike Pence has had some interesting conversations today.
Yeah, and, you know, the conversations that are happening surely are about whether the president needs to invoke the 25th Amendment and name Vice President Pence as the acting president. And also another mechanism, if the president refuses to do so, but a majority of his cabinet believes that he's unable to execute the powers of his office, then they can invoke the 25th Amendment as well. So there's a way to do it if the president is unwilling to do it himself. I'm sure these conversations
Let me just interrupt you again.
On.
I'm sorry. As you can tell, breaking news situation. Maybe you can re-rack that video a little bit. Now we're just getting video in of that moment I was describing a second ago where the president did leave the White House, walked on his own onto Marine One, full suit, mask, and did get on and did salute a member of the military right there before boarding on his way to Walter Reed. That, again, another shot there, Marine One, moments before it took off. It's on its way to Walter Reed as we speak right now. But this was the footage just in the last 10 minutes as the president left the White House and got on board.
Right. COVID positive or not, the president travels with, as we've heard from Michael Bush and others, a contingent of people, including a military aide who carries the codes that we all know about. Also, the doctor. Secret Service agents, senior advisors, so those some of the people who got on Marine One for this transport to Walter Reed Medical Center. And you can see right now, here is another live picture of the transport in the process right now, being flown to Walter Reed. So we'll continue. Joshua Douglas, let's ask another question, perhaps historically. Take us into one of your law classes and answer some of the questions you get about a moment like this.
Yeah, I'm sure my class on Monday in election law is going to be very interesting and probably not what I had previously planned to do on the syllabus. The students are going to want to know about what happens if, you know, hopefully, of course, no one wants this, but if the president were to die before Election Day, can he be replaced on the ballot? Well, the ballots have already been printed. almost 3 million people have already voted in the 2020 election. So he'll be on the ballot, but then the question becomes, what happens to those votes? Well, states vote through the Electoral College, right? We don't elect the president directly. We elect it through the Electoral College in each state. So that raises the question of whether the electors in each state can vote for someone other than the person who wins that state. And that gets to questions regarding what's so-called faithless electors, electors who decide to vote for someone who hasn't won their state. And we saw this in 2016 in Colorado and Washington. And so it's a real big mess. It's the real answer in terms of how to proceed with all this if, the extremely unfortunate thing happens.
Well, and I just want to remind people at home, if you're just joining us, the president is en route to Walter Reed Medical Center. And by all accounts, we saw him get on Marine One. He waved. He walked himself onto Marine One. And the White House is telling us he is in good spirits. He has a low-grade fever, mild symptoms, and they're taking him to Walter Reed as a precaution. However, we're talking to Joshua Douglas, a constitutional law expert, about the contingencies in place for every president if something were to happen and they were not able to continue their duties. So, Joshua, I will let you continue, but I think it's important that we note that by all indications, the president is okay. He is positive for COVID. There's a reason he's going to Walter Reed. But our nation has laws in place, and it has contingency plans in place for every situation. So you have to believe behind the scenes they're working through every scenario so that they are prepared for anything. We have to think about the what ifs. Of course, we're thinking of the president right now and his health, and the First Lady and her health. But again, continue in your statement. I just wanted to interject real quickly that the president did walk himself onto Marine One and is headed to Walter Reed.
And I believe
And
what we're
that's
watching
great
now.
news.
It is. And Joshua, what we're watching right now is a live picture. I'm not quite sure whether you're seeing it where you are. It appears that Marine One has landed there at Walter Reed. Obviously, a very short ride, so we do expect momentarily to see President Trump get off. Again, video now and pictures have circulated. President, again, dark suit, blue tie, presidential face mask on with the presidential seal, gave the thumbs up, gave a wave, very much in view of the cameras. Imagery is important to all presidents. Certainly, President Trump is on that list, so he understood, I think, the power of that moment and letting people know, yes, I have it, but yes, I'm walking on my own. Thumbs up, wave, I'm okay, just doing what I have to get done here. You can see the public there rushing. They understand that what a kind of surreal and historic moment this is. Cell phones and cameras out. I'm sure members of the press there documenting this as well. The president, again, expected very shortly, as the crowd kind of converges there, to get off of Marine One. There's the pilot. He himself, smartly, wearing a mask. President Trump expected to get off there momentarily and begin what is expected to be a multi-day stay there at Walter Reed, what they're describing as a precautionary measure in light of his positive diagnosis and positive test last night. So that was the quick trip from the White House to this military facility. And again, momentarily, the president will be stepping out for what's being described as just a few days where he will continue to work from presidential offices that are there at Walter Reed. The president making very clear he is still in charge. There's been no transfer of power. And again, appeared to be in good spirits, walking out of the White House. And that's the first time we've seen him since that, alarming and unexpected tweet last night that he indeed tested positive. And I guess we're a few seconds away now from seeing President Trump deplane.
And we also know the First Lady has tested positive as well. She is remaining at the White House and in quarantine and being treated. And Democratic presidential nominee Joe Biden has also tested negative for the virus, along with his wife. But they have said that this is a bracing reminder of the seriousness of this virus. Now, you are looking now live at Marine One, as we've said, at Walter Reed Medical Center.
No problem.
We are
Thanks for having
awaiting
me.
the president to get off of Marine One. We saw him walk onto the aircraft, and we expect him to walk off here at Walter Reed.
Well, we can reset the stage a little bit as well here at about 4:40 Eastern time. Here comes some of the, you can see Mark Meadows, I believe, there is standing.
Chief of
top.
Staff Mark
Yep.
Meadows, yes.
And you can see the president inside there through the cockpit.
Here
with
comes
that
the president.
Blue dude tie, here he comes, yeah. At 4:40, the president's doctor said that Mr. Trump was being treated with an experimental drug aimed at supplying essentially antibodies to help fight the coronavirus infection. It's given as a one-time treatment through an IV. The president's doctor saying this drug was being given as a precautionary measure, and that the president was also taking zinc, vitamin D, an antacid, also melatonin and aspirin. And about 10 minutes later, Democrat Joe Biden said that the president testing positive for the coronavirus is a bracing reminder of the seriousness of the virus. He also says that he has received 2 tests, and as we mentioned just a short time ago, both of those tests came back negative. When you do look at this, I mean, according to that comment from Joe Biden, it is in fact a bracing reminder, because this president is perhaps one of the best protected people in the world. So we know he's tested likely every day, everyone who comes within contact with him or even close to him. And my experience a week and a half ago when I was at the White House was that there are not a lot of people around him, and those who are around him are not necessarily near him, if that makes sense.
And one thing we know about this virus is it does not discriminate. The young, the old, but we do know that it is specifically dangerous for those who are older, those who have a compromised immune system, who have other medical conditions. We know the president is 74 years old. He is not a picture of perfect health. However, he is surrounded by the best medical teams, but his symptoms are mild. We spoke with Dr. James Baker earlier. He is with the University of Michigan Medical School, and he said the one thing they will really be monitoring with the president, as they would anyone who has COVID and is hospitalized, will be the respiratory issues, that you're looking for anything in trouble with the respiratory tract, you're looking for possibility of pneumonia, that you want to prevent that. That is when things start to get complicated. So that is one thing that they will be watching. They'll also monitor his blood pressure. We have seen a number of reports, however, we still don't have a lot of evidence, but we know that people who have an elevated blood pressure, hypertension, any sort of cardiac events in the past are at a higher risk for developing complications of COVID-19. I spoke just last week with the director and president of the American Heart Association, and he said there is a lot that we don't know yet about this virus, but we do have some pretty early indications that anyone who has a history of heart disease is at an elevated risk. And so those are some of the things that they will be monitoring with the president at Walter Reed. And at his side, as Joe said, will be a military aide, the president's physician. Usually a president in this situation will have a couple of agents, FBI agents with them, Secret Service. And of course, we saw his chief of staff, Mark Meadows, getting off Marine One as well.
And if you think about it, just in the bigger picture, it is an extraordinary moment. We are, what, 7-8 months into this pandemic. We have more than 7 million cases in America. We have a death toll now near 210,000, 1,000 people per day, anywhere between 30 and 40,000 new cases a day. And maybe one of the lingering messages of this moment is that, you know, Mother Nature tends to always win, no matter the situation. And now this virus has gotten to literally the very top of the American government, has gotten to the very top of the greatest nation in the world. And so it does speak to a moment of that we're all human. And they couldn't even keep this thing out of the White House or out of the President of the United States. So hopefully it is a wake-up call that this was not a hoax. It's very real, so real that the President of the United States is on his way to the hospital on this Friday night. It's a remarkable moment.
I'd like to introduce Barbara Perry. She is the Director of Presidential Studies at UVA's Miller Center. Barbara, thank you for joining us. First, your reaction to what we're seeing.
Well, just to the last comment, it just suddenly buzzed into my head that very near where President Trump is now hospitalized, in June of 1960, President Kennedy gave the commencement speech at American University in Northwest Washington, and it's known as the Peace Speech because it's an olive branch to the Soviet Union to make peace, to come to an understanding about banning nuclear tests to keep from fouling our environment. This is in 1963. And towards the end, he said, an often commented upon statement, he said, for in the final analysis, We all breathe the same air. We all cherish our children's future, and we are all mortal. And of course, it was so poignant because he would lose his life in November of that same year. And of course, we hope for a much better prognosis, and we hope for complete recovery for the incumbent president. But just to your point about Mother Nature wins out in the end, or indeed we are all mortal. So I'm thinking about that, and I'm thinking about the history of presidential illnesses, particularly during campaigns.
Can you walk us through that?
Sure. Yes, I'll start with more modern presidents because it's more apt comparison. Because really, prior to the 1900s, the early 1900s, even up as close as to 1920s, presidents, it was thought to be unseemly for them to be out campaigning around the country, and of course, travel was much more difficult. So I'll start with FDR. Just coming into office, or just running for office in 1932, people wondered, since they knew he had been a polio victim from 1921, he had been paralyzed from the waist down, he could not walk under his own power. So people wondered, what impact could that have should he be president in 1933? And we know he went on to be elected 4 times. But running that 4th time, he was literally dying of congestive heart failure. That information was not passed to the American people. His wife, Eleanor, after the president's death in April of 45, after he had been elected for the 4th time and been inaugurated in January of 45, Eleanor in her memoir said, I just don't think he could accept that he was dying. He had always survived, and he had survived polio. So even he couldn't accept it. But the fact was he ran, and in just a few weeks before the election in November of 44, to show that he was hardy enough, he ran all through, they drove him all through all the boroughs of New York City in a cold driving rain, even had to stop halfway through to change his clothing. He was soaked to the skin, and then drove him into Ebbets Field, old Ebbets Field baseball stadium in Brooklyn, to let him give a speech. And everyone could see that he wasn't the robust FDR of 1933. But it was still a shock to the American people when he died of congestive heart failure, and actually of a stroke at Warm Springs in April 45. So that's the closest we've come to someone actually passing away just after the election. The better example in terms of, I think, how a president should handle this is Eisenhower. Had a severe heart attack in 1955 in third year of his first term out in Denver. And it was so serious, and heart treatment was so primitive in those days, they couldn't bring him back to Washington for 7 weeks. And he insisted that his cardiologist come out from Washington to Denver, and his press secretary, and basically every day they gave a press conference. And he said, tell the American people everything. They deserve to know, they should know. And then in 1956, in the summer of the election where he would be reelected, he had severe abdominal surgery. In fact, in the same complex where President Trump now is, or in Walter Reed Old Hospital. Now it's in the old Bethesda Hospital that they call Walter Reed Complex. But he had severe abdominal problems. He had ileitis, which I think we now call Crohn's disease. But again, he told his doctors, tell the American people what's happening. He survived, he recovered, and he was elected the 2nd time in 1956.
Barbara, you're making a very important point here, and as we await either word from the medical experts at Walter Reed or out of the White House, we have seen historically that presidents, and you just mentioned Eisenhower, wanted to be transparent and said, tell the American people everything. So based on what we've seen in history and what we know about this president and this White House, what do you anticipate as far as communication with the American public in the next few minutes, hours, and days?
I suppose if we say, based on the last 3.5 years, that transparency has not been the watchword of this administration or this candidate when he was a candidate and Mr. Trump in 2016. People certainly know of late and most recently about not releasing his tax returns. And he believes, and maybe he does have a valid reason, that because they are under audit. So there's that. But also recall that he did not, as many presidential candidates have done, including, for example, John McCain, who had suffered from skin cancer. And so he released his medical records when he was running for president. But President Obama, then candidate Obama in 2016, did not, except for that letter from the rather bizarre New York doctor who said he would be the healthiest president ever to serve. And we don't have any reason to believe, except for these occasional trips to Walter Reed that he has had over the last 3.5 years that there's not been transparency about. But he does seem to be a rather hale and hearty figure, despite the fact that he is overweight and he's 74 years old and doesn't seem to have a great diet. So again, if we're going by the precedent of this president, so the precedent of this unprecedented president, it doesn't seem likely that they're going to flood the airwaves and journalists with a lot of transparency and a lot of information. But they have given us enough today to go on, I think.
And Barbara, you make such an interesting point, because there's so much chatter online right now that in this very surreal and historic moment, we have not yet seen an actual press conference from anyone in the White House. We did get word, and it's starting to spread online now, that President Trump did tape a video moments before getting on board Marine One on his way to Walter Reed, and now has posted that on Twitter. We are going to turn that around and share it with you as soon as we can. But in terms of a formal news conference or press conference, we have not seen that yet there in the White House briefing room, or there's been nothing since the news broke that he was going to be flown to the hospital, which does seem a little odd. At the end of the day, the health of the president, no matter who he is, the health of the president is a matter of public record in a lot of ways, and also a matter of national security. So can you talk about why, when anything about the president's health, for whatever reasons in question, literally, the phrase is true, the world is watching, and it's a strange time to not hear in a formal way from this White House in more detail about what exactly is going on and what they expect to happen in the next few days?
Well, you're absolutely right in your description and in your concept that, yes, the whole world is watching. There used to be only half facetious statement that when the president gets a cold, the stock market goes down. And that's been true. And we saw it today. We woke up to the news, or people went to bed with the news of the president testing positive and being symptomatic as of late last night. And it makes people think, did they wait deliberately until the wee hours of the morning when many people, at least on the East Coast, were already abed? Did they wait deliberately to do that? And I think the other thing to notice is these would be the polls that have shown that over the last 6 to 7 months of this coronavirus crisis, the American people, in a vast majority, do not trust the president's information or the White House's information, but particularly the president on corona and on the vaccine. And so I think that because of that, the Washington Post has now indicated that he has told 25,000 prevarications in his 3.5 years in office. It is a bit like the boy who cried wolf. So for someone to say this is a hoax or this isn't really a serious disease, and then to come down with it, one shouldn't be surprised if a majority of Americans do not believe what the president is saying or are critical of the White House for not being more forthcoming.
What about the timing of this, Barbara, this close to an election?
Oh, amazing. I would compare it historically to Richard Nixon in 1960. People might be familiar with the first debate from the 4 that he did with John F. Kennedy, and the fact that Nixon looked so ill, and it was because he was. And that was at the end of September, but not too different from the time to the election. He had had a terrible wound on his leg. I think a car door had hit it. And it didn't seem to be too serious, but it was painful, but it got infected. So he was hospitalized just before the debate for a week or two and lost 15 pounds. So he looked terrible at the debate. He also came down with the flu. So he didn't have anything that was fatal. He didn't have a fatal diagnosis, but he had 2 situations, 2 infections, hospitalized, looked terrible, was sweating profusely in the first debate, and didn't have his best performance. And most people think Kennedy won that debate. And that it was such a close election. Kennedy won the popular vote by only 1/10 of a percentage point in 1960. It could have made the difference. So something like this, talk about an October surprise, it could sway the election.
Well, and Barbara, what an interesting walk back through history. Before we let you go, I would like to get your reaction and your insight into some of the contingencies that may be happening behind the scenes right now. We do know, and we're working only off of the information, that the president is well enough to walk onto Marine One, and he is going to be treated at Walter Reed as a precaution, but he has a mild fever, and otherwise he is in good spirits. Having said that, though, there are conversations that inevitably are going to be happening behind the scenes to plan for any contingencies. What we know about COVID is that it can progress differently in different people, and there is just no way to know how the president will respond to the treatment. So can you talk from a presidential historic perspective about the contingency plans happening right now in the White House?
Sure. Well, my colleague from the University of Kentucky Law School, I know, filled us in on the law, and that would be the 25th Amendment, for example, that if the president himself should feel that he's unable to carry out his duties, even temporarily, that he could sign a statement handing over the reins of power to the Vice President Mike Pence, and that is provided for in the 25th Amendment. And by the way, that came about because Dwight Eisenhower, having suffered this serious heart attack in '55, told his then Attorney General Herbert Brownell, start thinking about a law or a constitutional amendment because I can't get back to Washington, for example. And then with the Kennedy assassination in 1960, only provoked another push to get the 25th Amendment. So I'm sure all that's going on behind the scenes in the White House. Should the president take a severe turn for the worse, because we know this can happen with COVID, let's say he had to go on a ventilator suddenly, couldn't speak, and maybe was non-compos mentis, then the cabinet under the 25th Amendment can vote along with the vice president that it is time, at least temporarily, to hand over the reins of power to the vice president. So I'm sure they're anticipating that. And then politically, they must be anticipating ways that if the president comes back from the hospital and could do some virtual campaign events, much as Joe Biden, being prudent, is doing, I'm sure politically and in terms of campaigns, they're thinking about those contingencies now as well.
And Barbara, I want you to listen and watch this along with us. I mentioned a second ago that the president had tweeted out a video literally moments before going on Marine One on his way to Walter Reed. We now have turned around that video. This is what the president posted on Twitter in the last few minutes, the first time we've heard from him since he announced he had tested positive. Let's take a listen.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
A very quick Twitter video there from President Trump. I think
right.
I'm doing very well. Barbara, you know, this is a president who is very much about bravado and image, and I'm in charge and I'm okay, and that was not as strong a statement as you would expect from President Trump based on his track record. I think I'm doing very well, but we're going to make sure that things work out. How do you read that statement?
Well, just as you are, it wasn't a ringing endorsement of how he was feeling or of his perhaps diagnosis from the doctors. I also have to remember my doctorate is in political science, not in medicine, but he looked a little pale and peaked to me, and maybe it's just that he didn't have his usual makeup on as one is rushing off to the hospital. Perhaps they didn't think in those terms. I thought he looked more natural, quite frankly, but he did just look a little peaked, and they had said the other night that he was rather lethargic, so he seemed a little bit that way to me. But it's just good for his image that he did it, that people can see he's upright, he's standing upright, he's dressed in his suit, he doesn't have pajamas on. But I also want to point out Ronald Reagan, right after the assassination attempt on him, the word came out that he had kept his sense of humor, and that when his wife Nancy, the First Lady, ran to George Washington Hospital, ran to his bedside as they were whisked into surgery, he said, "Honey, I forgot to duck." And then right before the doctors put him under for the surgery, and he was bleeding out, he was going to die if he hadn't been operated on right away, he said, he looked around at the doctors, he said, "I hope you're all Republicans." And that came out, I can remember at the time, that came out right away, and it just buoyed everyone's feeling. So just the very fact that the president came on camera, looked a little peaked, but still he was standing upright. I think that will ease people's minds.
I couldn't agree with you more, Barbara. I think even to see President Trump today, I mean, put politics aside, to see the President of the United States giving a thumbs up to the camera, even saying a message to the American people, that's what people want to see and hear. Thank you for taking us through such a fascinating historical journey through different presidents and their health history and all of that. Barbara Perry, Director of Presidential Studies at UVA, we appreciate your time. I'm going to ask the control room as we get ready to introduce our next guest to cue up that video of the president again, because I think we'd all like to see it again, and maybe a time after that. So as we get ready to introduce our next, you guys are ready? You're on it? Let's share that.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
I think in light of him saying, I think I'm doing very well, right after that, he said the First Lady is doing well.
He's drawing a difference.
Maybe we're making too much of it, but I think that's probably why it caught all of our ears. Let's bring back Dr. James Baker, professor of allergy and immunology at the University of Michigan Medical School. Also former member of the Council of Advisors for the Office of Science and Technology Policy in the Bush and Obama White House. Doctor, you've had a few minutes since we chatted last. What's on your mind right now?
Well, I think that video was reassuring. The president seemed calm. He certainly wasn't short of breath. He was able to talk in complete sentences. And, we can read what we want to into his comment. I think it was probably an attempt at levity. But I think in general, he looked pretty well. And he certainly could walk. He didn't need assistance. So I think he looks pretty good right now.
Well, and I think just trying to really get a grasp of the situation, if he weren't well, they wouldn't let him do that, and they wouldn't let him walk onto Marine One, correct?
Correct. If he were acutely ill, they'd be rushing him to George Washington Hospital, for an acute intervention. That's not the case here. They calmly took him up to Walter Reed. They've been treating him during the day. From the sounds of it, he got an experimental treatment that we can talk about. But I think overall, it looks like a stable situation. And I think they're just being very careful, which is totally appropriate.
Yeah, Dr. Baker, let's talk a little bit more about that, since people may just be joining us. The president was given what was called a polyclonal antibody cocktail, and he also received and completed a infusion without incident. These are some medical terms a lot of people may not be familiar with. Walk us through what exactly that is and what it does.
Well, this is 2 monoclonal antibodies, and unlike the serum that they collect from people, the antibodies in this cocktail are totally directed against the virus. So in fact, it's like getting a super dose of antibody that can bind and neutralize the virus so it can't infect his cells. And this cocktail was developed by a company named Regeneron in New York. It's been tested, and the preliminary data showed some value of it in helping people recover more quickly and having a less severe course of illness. So I'm sure they gave him that. They'll be giving him remdesivir, which is the antiviral drug that's been developed and shown to be effective. And I would guess they'll probably also give him steroids, which have also shown to be effective and prevent the respiratory symptoms that we're all worried about.
Doctor, we've seen this happen with Boris Johnson, the Prime Minister of Britain, where he took a turn for the worse and was ultimately hospitalized and then went into the ICU. What have we learned about this virus and how to treat it since that happened early on in the pandemic?
Well, I think we've learned that it's better to be proactive and to try and improve people's respirations long before they get to a point where they need a ventilator. Unfortunately, most of the people we put on ventilators in March and April died, and it was over 90%. So in fact, we want to intervene before that. We want to give them the drugs that might control the virus and basically prevent the pneumonia before it starts.
All right, one other question before we go, because I did find it reassuring when we were wondering why he was being taken on Marine One to Walter Reed and not just taken by motorcade. You said that this was actually a good sign.
Yes, I was a military physician at Walter Reed for over 10 years. Whenever the president came, he came by helicopter. The logistics of trying to get a motorcade through the district and up to Bethesda were just too difficult. This is actually easier for everyone. So I feel very reassured that they calmly, all got on the helicopter and went up there. There was no emergency. There was no urgency in what they were doing. So I think we can feel comfortable from that.
That plus seeing him on the Twitter video, I think, was reassuring as well. Doctor, thank you so much for joining us. We have just a few seconds left here, but we want to remind people we will have full coverage of this extraordinary news event coming up on News Nation, 7 to 10 Central tonight, as we cover, of course, President Trump, his diagnosis, and now has been hospitalized for a few days, and what that means for the country and for the election and so many other things. So full coverage coming up in just about an hour from now, Central Time.
And I really do think, politics aside, seeing the president there, I think anybody right now in the time that we are in with COVID are very nervous. So our thoughts are with the president and the First Lady and his family. More coverage tonight on News Nation.
See you in an hour.
We get that the things you surround yourself with reflect who you are. Your style, your drive, your passions. Venture through a curated collection of astonishing items at touchofmodern.com, because sometimes things aren't just things, they're you. Go to touchofmodern.com and discover the world's most unexpected items.
Meet Glow